What if the very nutrients your body depends on every day could be the missing link to restoring damaged nerves? And what if, instead of relying only on medications that manage symptoms, you could support your nervous system in a deeper, more natural way? Nerve damage, also known as neuropathy, affects millions of people worldwide and can stem from conditions like diabetes, chemotherapy, injuries, infections, autoimmune diseases, and even simple nutritional deficiencies. The symptoms can vary depending on which nerves are involved, but many people experience numbness, tingling, burning sensations, sensitivity to touch, muscle weakness, pain, or even difficulty walking and handling everyday objects. While conventional treatments can help control discomfort, options that truly support nerve repair are still limited. However, growing scientific evidence suggests that certain vitamins and nutrients may play a meaningful role in helping nerves recover and function more efficiently. In this video, we'll explore the science behind using key vitamins as a natural approach to support nerve health and reduce neuropathy symptoms. We'll begin with essential B-complex vitamins, B12, B1, and B6, then move into other powerful nutrients like alpha-lipoic acid and vitamin D. You'll also learn about the best food sources and the supplemental ranges often used for nerve support. As always, it's important to work alongside your healthcare provider to test for deficiencies and determine what approach is best for your individual needs. 1. Vitamin B12. Let's start with vitamin B12. This water-soluble vitamin plays a crucial role in maintaining healthy nerves. It is responsible for forming the protective myelin sheath that surrounds nerve fibers, much like insulation around electrical wires. This sheath allows signals to travel quickly and efficiently throughout the nervous system. When vitamin B12 levels drop, this protective layer begins to deteriorate, slowing nerve communication and potentially leading to numbness, reduced reflexes, and progressive nerve damage. Deficiency in B12 is especially common among older adults, with estimates suggesting that between 10% and 30% of individuals over the age of 50 may not have adequate levels. The standard daily recommendation for vitamin B12 is 2.4 micrograms, but therapeutic doses used in neuropathy are often significantly higher, typically ranging from 1,000 to 2,000 micrograms per day. This is largely due to reduced absorption as we age. While foods like meat, fish, eggs, and dairy provide B12, they may not be sufficient for everyone, especially vegetarians and vegans. In these cases, supplementation becomes an effective option. Methylcobalamin, a bioactive form of B12, is particularly well absorbed and has been associated with improvements in symptoms such as numbness, pain, and balance issues. Maintaining optimal B12 levels, whether through diet or supplementation, is essential for preserving nerve integrity and function. 2. Vitamin B1, thiamine. Next is vitamin B1, also known as thiamine. This vitamin is fundamental for proper nerve signaling and plays a key role in producing neurotransmitters that allow communication between nerve cells. A deficiency in thiamine has long been associated with nerve damage and peripheral neuropathy. Individuals with diabetes, chronic alcohol use, kidney disease, autoimmune conditions, or poor nutrition are especially vulnerable. If left untreated, prolonged deficiency can result in irreversible nerve damage. A specialized form of thiamine called benfotiamine has shown particular promise in supporting nerve health. It has higher bioavailability than standard thiamine, meaning it is more easily absorbed and utilized by the body. Research has demonstrated that benfotiamine may improve nerve conduction, reduce pain, and alleviate neuropathy symptoms, particularly in people with diabetes. Common supplemental amounts are around 300 milligrams per day, though this should always be tailored under medical guidance. While thiamine can be found in foods like whole grains, legumes, spinach, and seeds, supplementation is often necessary when nerve damage is already present. 3. Vitamin B6, pyridoxine. Moving on to vitamin B6, also known as pyridoxine, this nutrient is vital for both brain and nerve function. It contributes to the production of neurotransmitters and helps maintain the integrity of the myelin sheath. Low levels of vitamin B6 have been linked to nerve inflammation and neuropathy, particularly in individuals with uncontrolled diabetes. Clinical studies suggest that supplementation may help improve nerve signaling and reduce symptoms when used appropriately. Typical supplemental amounts used in research range from 100 to 200 milligrams per day over a period of several months. However, it's important to note that excessive intake over long periods can actually cause nerve damage. The general recommended intake for adults is between 1.3 and 1.7 milligrams daily. Food sources include poultry, fish, fruits, starchy vegetables, nuts, and whole grains. For those with neuropathy, careful supplementation, without exceeding safe limits, is key to supporting recovery. 4. Alpha-lipoic acid. Beyond the B vitamins, alpha-lipoic acid is another nutrient gaining attention for its role in nerve health. This powerful antioxidant is naturally produced in small amounts by the body and is also found in foods like spinach, broccoli, and tomatoes. Alpha-lipoic acid works by reducing oxidative stress and inflammation, both of which contribute to nerve damage. It also helps regenerate other important antioxidants such as vitamin C, vitamin E, and glutathione, strengthening the body's overall defense system. In addition, research suggests that alpha-lipoic acid may promote the regeneration of nerve fibers. Clinical trials, particularly in individuals with diabetic neuropathy, have shown improvements in symptoms such as burning, numbness, and pain. Oral doses typically range between 600 and 1,200 milligrams daily. While generally well tolerated, it's important to consult a healthcare provider before starting, as it may interact with certain medications or affect blood sugar levels. 5. Vitamin D. Finally, vitamin D is another essential nutrient that plays a role far beyond bone health. It acts as a hormone in the body, helping regulate inflammation and supporting proper nerve signaling. Low levels of vitamin D have been linked to an increased risk of neuropathy, especially in people with diabetes. Symptoms such as pain and reduced sensation are often more pronounced in those who are deficient. Vitamin D deficiency is extremely common, affecting a large portion of the population, particularly older adults and those with limited sun exposure. While foods like fatty fish and fortified dairy products contain vitamin D, sunlight remains the primary source. Even short periods of sun exposure can help maintain adequate levels. In some cases, supplementation may be necessary. The active form, calcitriol, has been studied for its potential to reduce inflammation and protect nerve cells. However, dosing must be carefully managed under medical supervision to ensure safety and effectiveness. 6. Other supporting nutrients. In addition to these key vitamins, several other nutrients have shown potential benefits for nerve health. Acetyl L-carnitine, for example, supports energy production within cells and has been linked to nerve regeneration and improved sensation. Certain polyphenols found in green tea and curcumin may help reduce inflammation and protect nerve pathways. Resveratrol, a compound present in grapes, also demonstrates neuroprotective properties in research. Meanwhile, maintaining a healthy gut through probiotics may indirectly support nerve function by reducing inflammation and contributing to the production of essential B vitamins. In conclusion, while nerve damage can be complex and challenging to treat, emerging research highlights the important role that targeted nutrition can play in supporting recovery. Vitamins such as B12, B1, B6, alpha-lipoic acid, and vitamin D offer promising benefits when used strategically. By combining proper nutrition, supplementation when needed, and medical guidance, it may be possible to support nerve repair and improve overall quality of life.